And welcome, Hypnotherapy by Rachel Gibson. You would have joined this workshop and been given the relevant codes. To the left of the classroom is a quiz once you've completed this course. Once completed your quiz, please do email team@thedigitalpsychic.com. You will receive a certificate of completion once you've reached over 85%. You're welcome to continue development with me and request to join Facebook Messenger practice area. Please do contact Rachel Gibson BA Honours page. I hope you enjoy the workshop short course. I use various resources and discuss via webinar, bringing you useful resources from the internet, collaborating it with my own experience is. What is hypnotherapy? Hypnotherapy is a type of complementary therapy that uses hypnosis, which is an altered state of consciousness. Hypnosis is widely promoted as a treatment for various long-term conditions and for breaking certain habits such as smoking and also eradicating fear. Hypnosis. Within science, there is no debate as to whether hypnosis exists or even works, but science simply cannot agree on what it is and how it does work. Although, as the British Society of Clinical and Experimental Hypnosis states, in therapy, hypnosis usually involves the person experiencing a sense of deep relaxation with their attention narrowed down, focused on appropriate suggestions made by the therapist. Hypnosis works by altering the state of consciousness in such a way that the analytical left-hand side of the brain is turned off, while the non-analytical right-hand side is made more alert. The conscious control of the mind is inhibited, and the subconscious mind is awoken, since the subconscious mind is a deeper-seated, more instinctive force than the conscious mind itself. This is the part which has to change for the patient's, client's behavior and physical state to change. The reason why I put patient in there was for a reason. They are not patients because we are not medical. I did that deliberately. Client's behavior. Okay. Misconception. The technique does not involve the patient, client, being put into a deep sleep, and the clients cannot be made to do anything they would not do ordinary. They are not patients because they are not under medication. They're not under medical. The benefits of hypnosis is sleep disorders, depression, stress, post-trauma anxiety, grief and loss, phobias and fears. Hypnosis also might be used to help with pain control and to overcome habits such as smoking or overeating. It also might be helpful for people whose symptoms are severe, who need crisis management. Hypnosis might not be appropriate for a person who has psychotic symptoms, taking drugs, drinking alcohol, such as hallucinations and delusions, or for someone who is misusing drugs. It should be used for pain control only after a doctor has evaluated the person. A doctor would have a patient. A hypnotherapist has a client. For any physical disorder that might require medical or surgical treatment, hypnosis also may be a less effective form of therapy than other more traditional treatments, such as medication for psychiatric disorders, such as bipolar, schizophrenia, and those type of disorders, but that would fall under medical. Sometimes we have to make referrals to other medical professions, but sometimes medical professions actually do refer people to hypnotherapists for varying symptoms. Hypnosis is not a dangerous procedure. It is not mind control or brainwashing. A therapist cannot make a person do something embarrassing or that a person doesn't want to do. Hypnotherapists should conduct their practice in a manner consistent with upholding of the good name of this profession and to avoid any statements or actions that will bring the profession into disrepute of hypnotherapy. Hypnotherapists should not guarantee cures for any condition or make misleading claims or statements as to the outcome of the service that they do offer. Hypnotherapists should make clear right from the outset of the therapy the terms, conditions, and the charges for that therapy. It might be that you need to say to somebody that they need longer therapy, say 12 sessions. If it's complicated, make sure you do that from the outset. Hypnotherapists are required to comply with the law in all respects, particularly noting the requirements with regard to the treatment of clients in relation to their race, religion, age, and gender status. Hypnotherapists should maintain confidentiality and disclose the limits of confidentiality to their clients. For example, a therapist is subject to the law of the land with regard to reporting matters that may be of safeguarding. So when you are actually producing your confidentiality policy to your clients, do say to them prior to the therapy that you might have to breach confidentiality if it is a safeguarding matter. In the publication of any clinical material, the client's anonymity and privacy should be safeguarded, data protected. Hypnotherapists should offer services only within the boundaries of competence. Do not call them a patient, call them a client. Only if you're medically trained can you use that terminology. Hypnotherapists should always act in the best interest of the client. This may require recognition that a case may be beyond their expertise, referral to a more senior practitioner, or a practitioner of another discipline, such as a doctor. Hypnotherapists should maintain a professional relationship with clients with appropriate boundaries. That does allow the client to maintain and develop independence and autonomy. And this does apply to the duration and cost of that therapy. Therapists should not exploit clients sexually, emotionally, or financially. And currently agreed best practice is that intimate social contact with the client is not to take place for a period of at least 2 years from the final session of therapy, unless they are a student. Hypnotherapists should maintain a premises in which they conduct their therapy to a suitable standard, considering health and safety and hygienic and professional standards, maintaining their own personal appearances and hygiene to a professional level. Hypnotherapists should inform clients if audio or visual recordings of sessions are made and obtain the client's written consent in advance or via disclaimer through a website. Hypnotherapists should hold indemnity insurances that adequately does cover their professional practice and public liability. Hypnotherapists should maintain written records of therapeutic sessions in accordance with Data Protection Act of the UK and other relevant regulations for other countries. That is soon changing. Please do bear that in mind. You need to keep it in a secure storage and arrange it so that it is secure. Hypnotherapists should ensure that all advertising and promotional literature is accurate in relation to their professional qualifications, services that they offer. Any such material should be in accordance with the legal requirements of advertising practices, and they should offer honest, accurate information, informed by best practice as to the benefits of this therapy. Hypnotherapists should not claim or imply that they possess qualifications that they do not have. Hypnotherapists should not hold out, advertise, or even apply that they are qualified to offer orthodox medical treatment or pass themselves off as medically qualified unless they are legally registered physicians and licensed to offer those treatments. Hypnotherapists should satisfy themselves that when a client presents with physical symptoms for which hypnotherapy is being sought by the client, that the client is advised that a medical assessment should be sought. Hypnotherapists must obtain written consent of legal guardians, and in case of minors, they should hold DBS checks, and that they accept as a client before they even commence any therapy. Collaboration. You need their help too. Your client needs to be at a point in their life where they are ready to undertake the changes that may happen resulting from the session you will do for them. Your clients must be willing to receive. Saying it makes them think it. When you use a suggestion in therapy, you will be making suggestions to the subconscious mind. This then makes the client have new thought patterns and is able to successfully reach their goals. We should be using empowerment and suggesting, not telling. Sensory thought is thinking about events that trigger senses. So you can take your clients back into memory. When these memories arise and are triggered, the senses become heightened, more alert, and very astute, making the whole experience very real for them. Senses are alerting, and it brings back memory. Thinking thought. Thinking actually changes the body because the mind is connected to the body. So any thinking actually has an impact on the rest of somebody's physique. Evaluation is so important when doing any therapy work. Check that it is working and that it does work. Never be afraid to ask your clients in the session and following up with them after the session. Evaluating, feedback, important. How have they responded? How they are feeling afterwards? Ways of connecting, healing your client. They need to use the terminology that they themselves tell you. Don't change the terminology. If somebody speaks in a certain way, write it as that. Use language that they understand. Empowering is essential. The attitude of the therapist is key. One of the most important aspects of being a hypnotherapist is having confidence. You too must believe yourself that the therapy works. It is an essential part of being a therapist. The conscious mind is where we spend most of our time, but it's actually the weakest part of our mind. The conscious mind is the rationale, analytical part of the mind. It's the thinking, it's the judging part of the mind. And due to conditions and environments and influences, our minds can be changed. Focus and confidence is so imperative. I'm going to now discuss temporary memory. Now, our temporary memory is so limited. This is the memory that we need and use in our daily lives, like remembering where we live, people's names, shops, and scientific research has proven that our conscious mind can only hold a tiny bit of information at one time. This is the part of our mind that we use every day. Overall, the conscious mind is very weak compared to the subconscious mind. And it is in the subconscious mind where trauma and our past memories exist. And this is, as a hypnotherapist, is where we will be accessing this information from the subconscious mind. Subconscious is our imagination, the permanent memories, the habits, those feelings, the trauma, emotions, our belief systems, and our autonomic. The subconscious mind is the most powerful part of our minds. This is the part of our mind that is control and that will help you to achieve goals. The subconscious mind is the part of the mind that we work with in hypnosis. This is where our imagination is stored. Imagination is more than just creativity. Imagination is also our perception of the world around us And it's so important to remember that everybody's perception is different. In hypnosis, what we do is reprogram. Habits, feelings, beliefs, and emotions are stored in the subconscious mind. The subconscious mind is the feeling mind. Hypnosis can help you become aware of the feeling or trigger an emotion that is connected to an issue. And when you allow this to happen, you are on your way to making permanent change. We have to reprogram. Our autonomic nervous system is things that we do know. And this is where we do things automatically. Breathing, eating, our heartbeat, blood circulation. When we cut off the supply, when we cut ourselves off, we don't have to tell ourselves to heal. We don't have to tell ourselves when we are tired or hungry. Our subconscious part of the mind takes care of all of that. It's a very, very powerful part of our mind. In hypnosis, we use what is classed as suggestion therapy. Suggestion therapy is simply just suggestion. You are making suggestions to the subconscious mind to improve, resolve certain issues that are happening for your client. Most hypnotherapists use only suggestion therapy. If your client came to you with a weight problem and wanted to lose weight, once you've got to the subconscious mind, then with suggestion therapy, you could make suggestions prior to any treatment, such as eating healthily, feeling motivated, exercising, and imagining themselves slimmer and fitter. And we would use scripts to reprogram that mind, but useful suggestions first. There's various ways of doing hypnotherapy. There's various techniques that I will discuss with you throughout this course. Regression therapy is one. Regression simply means going back in time. You can regress your client back to events in this lifetime or in past lives. Regression itself is an advanced form of hypnotherapy and can be studied and performed once you feel confident and expressed with suggestion therapy. I do have a separate course, past life regression course. Using clear and decisive language is so important. Clear and clean language is essential in hypnotherapy or any other therapy. Clear, precise language starts from the moment that you come into contact with your client, either be that by telephone, email, when they walk through your door. Do not mislead. Be honest and integral. Precise. Don't ever put an unwanted thought in somebody else's mind. In your client's mind, you want to be making them feel safe. Using a meditative process to begin your therapy would be useful. We then go on to deepeners. Now, deepeners and deepening in and throughout a hypnosis session is very essential. And through scripts, you will be taking your client through different layers of deepening. Deepening just means taking them to another level of relaxation, so they feel deeper in that relaxation. This enables the client to feel more and more relaxed. And that's exactly how a deepener would sound. I'm going to take you now on a journey, and we're going to go down some stairs. And whilst we're counting from 10, 9, 8, 7, you are feeling more and more relaxed. Now, anchoring is an important part of hypnotherapy also. Anchoring is to enhance the positive feelings that the client experiences during sessions. So if they're feeling happy, strong, empowered, or indeed any positive feeling, then you would anchor that affirmation, that feeling for them. To do this, you would simply get the client to breathe in the positive feeling and feel it move all the way up through the body into every cell, from the root right the way up through the chakras. Only anchor the positive feelings for the client, never, ever the negative. Once you actually introduce your scripts and you use your deepeners and you get the client into a relaxation trance, you return them to a conscious state of mind. 1 to 10, at the count of 10, you will be back here with me in this room. On this time, on this day, 1, 2, and 3, letting any scenes, feelings, emotions fade into the background. 4, 5, and 6, feeling yourself return to this room and moving your fingers and toes as your eyes wake. 7, 8, 9, nearly there. 10, you're now wide awake with me. Please go and get a drink of water. And then you would actually feedback what that person had said to you, and your evaluation report should follow. It's very, very rare, but a client may not respond immediately to your request for them to emerge from hypnosis. It's purely because the trance state is so relaxing and such a lovely place to be that they are so reluctant to come out. Every person is a potential hypnotic subject. However, no one can be hypnotized without their knowledge or permission. By use of words and actions, a hypnotherapist creates an illusion, and if the person is to be hypnotized and is willing subject, there is a 90% success rate that can be achieved. Now you may ask, what does make a good hypnotic subject? It's not easy to look at someone and say whether they are or not. But there are certain guidelines that you can pick out into the conversation that may help you to decide this and practice with them. There are, however, several tests that you can do that can indicate how receptive and responsive your client may be. These are called suggestibility tests, and they are designed and devised to see the suggestibility of the client, and the greater the suggestibility, the more receptive the client shall be. You can introduce an icebreaker, a suggestibility exercise measuring that receptivity and responsiveness to suggestions. The greater the client's suggestibility, the more receptive a hypnotic candidate that person becomes. However, you must bear in mind that this doesn't guarantee 100% success rate. Before anything, we need consent forms, their name, address, date of birth, medical, data protection, filing cabinets. It's important to get an overall picture and asking what they require in order to give them the therapy. This is an example of a weight loss form. You have name, their age, marital status, are they single, what's their occupation? Okay, they're an accountant. Is your life stressful? Very. If so, in what way is it stressful? Everyday life situations, lack of friends, family, I'm on my own. Do they have children? Are they married? And you want to know as much information as you can. So the introduction. You would take a nice deep breath, close your eyes, begin to relax. Just thinking about relaxing every muscle in the body. As your client begins to focus on their breathing and inner sensations, and the awareness of external surroundings will decrease. By breathing deeply, the client becomes aware of their internal sensations. The body is introduced to relaxation. The results are that the pulse slows, the breathing slows, the client begins to withdraw, and they can direct attention to the suggestions that you are giving them. This is another example of a deepener. Imagine a beautiful staircase. There are 10 steps, and the 10 steps lead you to a special and peaceful, beautiful place. I'm going to count backwards from 10 to 1. You can imagine taking the steps down, and as you take each step and relax even deeper. 10, relax even deeper. 9, more relax, and so forth and so forth. In order to further deepen the trance state, a count is used that usually goes from 10 to 1. You count backwards from 10 to 1 as the trance deepens, and forwards from 1 to 10 as you return to full consciousness. Although the image of a staircase was used above, you can substitute it to any image you like in order to enhance the feeling of going down. You may want to use an image of an elevator descending 10 floors as follows. We're going into an elevator and we're at the 10th floor, 9th floor, 8th floor. And what you would introduce is you're feeling deeper and deeper into relaxation. You could use a train carriage, whatever it is that you decide to use. It's important to use a special place. Imagining a peaceful and special place. Imagining, or perhaps you can even feel it. And then what you do is insert description of that special place. You are alone. There is no one here to disturb you. This is the most beautiful, relaxed place, safe place in the world for you. Enjoying your special place for another moment, and then I'll begin to count from 1 to 10, and you can begin coming back to full consciousness, coming back, feeling refreshed as if you've been here for a long rest. Begin to come back now. 1, 2, 3, coming back, 3, 4, 5, and you would use description in between each of those numbers. And 10, now opening your eyes, coming all the way back, feeling great, feeling good. Using descriptive words exclusively or using reinforcement when describing the desired state. They strengthen the suggestion. You are feeling at ease, relaxed, calm, and comfortable. Paraphrasing it, suggestions are repeated to enhance comprehension, ensuring that retention, feeling the relaxation flowing through your body, feeling the warmth of this relaxation, relaxing every muscle in your body, feeling the muscles in your body relax. We use then what is classed as connective words, which have two functions. One, to maintain steady flow so the monologue will not be interrupted, and two, to proceed as a directive, such as now and relax, feeling all the muscles relax. Breathe in deeply now and relax all the muscles in your arms. And because you are relaxed, you're feeling a warmth flow through your body. In this context, the connective word "and" is a cue to respond. Words that specify time are used for stress and emphasis. They can signal the time and suggestions of that time, the beginning towards the end. For example, any of the following cues could be used to signal the beginning of a suggestion, releasing tension from your body. In just a few moments, you will experience total and utter peaceful relaxation. In the morning, you will awake refreshed, feeling relaxed as you come out of your subconsciousness, out of this conscious state. As you're feeling more and more aware, more and more relaxed, you can now come back, live your day as you are now starting a fresh new beginning. Time designation is really important. Here are some scripts that I've given for you. This is resources. These do not belong to me. All the materials in here are copyrighted by myself, unless there's references that are used. This is here for your benefit to look at examples of scripts that can be used from resources external. Practice each induction. Deepen a script that you have rewritten. Write your own with a winning subject and note your findings. Concentrate in practicing your voice tone and tempo, rhythm, and collaboration. These are the regulations. Okay, that was part 1 and 2. Practice on each other in twos, please. Pick a pair. So basically you have to pick a partner, and I want you to practice using tones, looking at those scripts. Just practice. Part 3 will be written on Rachel Gibson BA Honours page, or in the Facebook Messenger groups. If you have just joined me and missed part 1 and 2 and you're at the final stages, you can contact me at team@thedigitalpsychic.com, because some people will come in at different times in this workshop. So I hope you have enjoyed it. You would have had a code to access Easy Class. Once you have completed the class, there will be a quiz. Please do go to Facebook Rachel Gibson BA Honours, private message or contact me. And thank you so much.